Today we'll see how dantrolene works as an antidote for succinylcholine induced malignant hyperthermia. How dantrolene works as an antidote for succinylcholine induced malignant hyperthermia. The succinylcholine is a neuromuscular blocker, depolarizing neuromuscular blocker, and it also produces skeletal muscle relaxation. Dantrolene is a directly acting skeletal muscle relaxant, but still we can use dantrolene as an antidote for succinylcholine induced malignant hyperthermia. How we'll see. For that we should know what is the action of the succinylcholine. Succinylcholine is a depolarizing neuromuscular blocker. Why it is called as depolarizing neuromuscular blocker we'll see. By causing skeletal muscle relaxation, it causes malignant response that is called as malignant hyperthermia. Malignant hyperthermia means it's an abnormal, malignant means abnormal hyperthermia. There is a rise in the body temperature, abnormal rise in body temperature because of this succinylcholine when it is used as a depolarizing neuromuscular blocker for the skeletal muscle relaxation. When we say it causes skeletal muscle relaxation, that means the succinylcholine going to act on the NM receptor, nicotinic acetylcholine receptor, right? The succinylcholine going to act on the skeletal muscle where on the receptor, which receptor? Nicotinic acetylcholine receptor. And when it acts on this receptor, nicotinic acetylcholine receptor, there is a release of calcium from the sarcoplasmic reticulum and contraction of skeletal muscle occurs initially. After that, because of its prolonged action, it may lead to flaccid muscle paralysis. Now we'll see in detail how it causes malignant hyperthermia. As I told you, when this succinylcholine acts on this receptor, nicotinic acetylcholine receptor, which is present on the skeletal muscle, it releases the calcium from the sarcoplasmic reticulum. So how? We'll see. And when it releases calcium from the sarcoplasmic reticulum, this calcium ions causes contraction of the skeletal muscle, and contraction of the skeletal muscle may lead to malignant hyperthermia because there is an abnormal rise in body temperature because of this contraction of the skeletal muscle. I will see in detail. Now here you can see this succinylcholine. This succinylcholine is a quaternary ammonium compound, and it's a depolarizing neuromuscular blocker which is used for the endotracheal intubation. Succinylcholine is a depolarizing neuromuscular blocker, right? And it going to act on the skeletal muscle. When it act on the skeletal muscle, on which receptor? NM receptor, nicotinic acetylcholine receptor or NM receptor. So these receptors are inotropic receptors. These are the receptors which are inotropic receptors. So ligand gated ion channels. So ligand is the succinylcholine. So what happens when this succinylcholine binds to this NM type of receptor? There is an influx of the sodium ions, and because of that there is a depolarization of the skeletal muscle membrane. Why? Because there is an influx of sodium ions. And that's why there is a depolarization of the skeletal muscle membrane. And because of depolarization of the skeletal muscle membrane, what happens? There is an activation of the ryanodine receptor which are present on the sarcoplasmic reticulum. Why there is an activation of the ryanodine receptor. RYR means ryanodine receptor. Why there is an activation of ryanodine receptor? Because there is a depolarization of the skeletal muscle membrane. Why depolarization of the skeletal muscle membrane? Because there is an influx of sodium ion inside the skeletal muscle membrane. Why there is an influx of sodium ion? Because the succinylcholine binds to the NM type of receptor, and these NM type or nicotinic acetylcholine receptors are the inotropic receptors, right? And that's why there is a activation of this sarcoplasmic reticulum. Which receptor? Ryanodine receptors will get activated. Why? Because depolarization occurs. Now because of this depolarization, activation of this ryanodine receptor, and there is a release of calcium from this sarcoplasmic reticulum, and this calcium is responsible for the contraction of the skeletal muscle. Calcium is responsible for the contraction of the skeletal muscle. That means excitation. Excitation is what? Depolarization of the end plate. That is excitation. Depolarization of the end plate potential of the skeletal muscle membrane is coupled with the contraction because of this calcium, and that is called as the excitation contraction coupling. It is called as the excitation contraction coupling. And when this succinylcholine causes contraction of skeletal muscle, initially it causes contraction of skeletal muscle initially, right? But because of its prolonged action, unlike acetylcholine, it causes flaccid muscle paralysis. The duration of action of succinylcholine is at least 5 minutes. So because of its prolonged action, it produces flaccid muscle paralysis. But here what is we are discussing? How it produces malignant hyperthermia. When the succinylcholine, which is the depolarizing neuromuscular blocker, when it is combined with other anesthetics, like sevoflurane, halothane, isoflurane and succinylcholine, that may trigger the process which can be fatal. And that may lead to malignant hyperthermia. It's a rare genetically determined condition. Where there is increase in the body temperature and severe muscle spasm. Where there is a rise in the body temperature and there is a severe muscle spasm due to release of intracellular calcium from the sarcoplasmic reticulum. So metabolic acidosis and tachycardia may also be present. Right? So when this malignant hyperthermia can occur, it may occur when the succinylcholine is combined with the halothane, isoflurane, sevoflurane. So this can trigger the process which can be fatal. So combination of this anesthetic with succinylcholine is the most common triggering factor. Now we'll see how this dantrolene works as an antidote for the succinylcholine induced malignant hyperthermia, right? Now for that we should know what is this dantrolene. Dantrolene, it's a phenytoin analog, hadantoin analog or phenytoin analog, which will directly acts on the skeletal muscle, on the contractile mechanism of the skeletal muscle. That's why it is called as directly acting skeletal muscle relaxant. The brand name is the Rhinodex. And the dose of dantrolene is 1 milligram per kg. 1 milligram per kg. If required, you have to repeat the dose. Then, now by which mechanism it acts? It directly acts on the skeletal muscle contractile mechanism. Now, this dantrolene, where it going to bind? It is going to bind on the ryanodine receptor channels. Which are present on the sarcoplasmic reticulum. Where it is present? It is present on the sarcoplasmic reticulum of the skeletal muscle. So this dantrolene going to bind on the ryanodine receptor which is present on the sarcoplasmic reticulum of skeletal muscle. So what does it going to block? It will going to block this channel. It is going to block this ryanodine receptor channel. This ryanodine receptor channel, that means it will inhibit the depolarization triggered opening. Where we have seen here, because of depolarization of the skeletal membrane, because of the depolarization of the skeletal muscle membrane, there is an activation of this ryanodine receptor. Activation of the ryanodine receptor, where this ryanodine receptor present on the sarcoplasmic reticulum of the skeletal muscle, and there is a release of calcium, and this release of calcium causes contraction of skeletal muscle. Right, now this dantrolene, when it binds to the ryanodine receptor channel which is present on the sarcoplasmic reticulum of the skeletal muscle, it will block the channel. That means it will inhibit the depolarization triggered opening. It will block the depolarization triggered opening of the sarcoplasmic reticulum or ryanodine receptors. So that means it will inhibit the calcium release from the sarcoplasmic reticulum. It will inhibit the calcium release from the sarcoplasmic reticulum. So there will be no excitation contraction coupling. There will be no excitation contraction coupling. So no contraction of the skeletal muscle. That means it will inhibit the muscle contraction, and that's how it will release or it will relaxes the skeletal muscle. How it will causes skeletal muscle relaxation? Because there will be no excitation contraction coupling, or it will inhibit the muscle contraction. How? Because there will be no release of calcium from the sarcoplasmic reticulum. Why calcium is not released? Because there is an inhibition of depolarization. Why there is inhibition of depolarization? Because this dantrolene will going to bind to the ryanodine receptor channel which is present on the sarcoplasmic reticulum of the skeletal muscle. Means it will going to inhibit the depolarization triggered opening of the sarcoplasmic reticulum. Means it will going to bind to this particular ryanodine receptor channels. So it will block the release of calcium from the sarcoplasmic reticulum, and that's how it will going to help in succinylcholine induced malignant hyperthermia. That means muscle contraction is uncoupled from the depolarization of the cell membrane. Means this depolarization of cell membrane, skeletal muscle membrane, is uncoupled from the muscle contraction. So this dantrolene is effective orally, but this malignant hyperthermia is a life-threatening condition. So you have to use this intravenously. It is also available intravenously, 1 mg per kg, repeated if required. Dose is 4 to 8 mg per day. So where it is used? It is used in the malignant hyperthermia. It is also used in the neuroleptic malignant syndrome. It is also used to reduce the spasticity in the upper motor neuron lesions like hemiplegia, paraplegia, spinal cord injury, right? Multiple sclerosis. So these are the various therapeutic uses of dantrolene. But we can use this dantrolene as a drug of choice or as an antidote for the succinylcholine induced malignant hyperthermia by directly acting on the skeletal muscle contractile mechanism, right? And adverse effects, like it may lead to muscle weakness, or it's hepatotoxic, so liver function test can be monitored, or it also causes dizziness, drowsiness and diarrhea as an adverse effect. Dizziness, drowsiness and diarrhea as adverse effects, and other adverse effects like muscle weakness and hepatotoxicity. So this is how we discuss how dantrolene works as an antidote for succinylcholine induced malignant hyperthermia.